Solh, and today we have a very interesting guest with us. I will introduce him to you in a bit, but first of all, let me introduce you with the topic for the session today, which is why don't men talk about mental health? So our guest today with us is Devashish Palkar, and he is a consultant psychiatrist, and he'll be able to tell you and enlighten you about the session and the topics around it. So thank you so much for joining in. Would you like to say something to introduce yourself to the audience?
So thank you very much. It's indeed my pleasure and privilege to be talking about such an important topic. A topic which is very important, but it's not given that much importance. When we talk about mental health issues, we talk about various disorders which are commonly seen in the society like depression, anxiety. But when we talk about specifically men's mental health issues, I think these are the issues that we need to talk more about because there are a lot of men who are suffering, but unfortunately, because of a lot of factors associated with the stigma regarding mental health issues, they are not coming forward and seeking help, which is why I think this is a very pertinent topic to be speaking on.
Right. And I think so much stigma around it makes it extremely difficult for people to come up and talk about it. Like, especially when it comes to men's mental health. A lot of people don't want to talk about it, and people pressurize men a lot, and they really don't. Do you agree with that?
I think yes, because if you look around at the socialization of the concept of masculinity, that itself, we are taught from the childhood days that men are supposed to be strong, they are not supposed to be very expressive, they are not supposed to show their emotions, especially the emotions, which we people label as negative emotions like crying or express
Right.
frustration. So these emotions are something that people generally don't tend to associate with men. And this is what has been taught to men right from when they were kids. And this is how they grow up. And even when they feel sad, even when they feel frustrated about it, they try and hide those emotions. They don't express it openly. And as Sigmund Freud, who was a famous psychoanalyst himself, said, all the suppressed emotions, all the unexpressed emotions later on come out in the form of mental health issues. And that is very, very true, especially if you look around at the society.
Absolutely. I think it's a very big issue because we're suppressing their emotions. And I think when it comes to suppressing emotions, they will create some mental health baggage to the body. And it's very important to openly talk about it. So, what is the basic reason that you think that men don't talk about their mental health issues? What do you think it is?
Right. So starting with, if you look around the mental health issues, then they are almost evenly distributed when it comes to all genders, right? And I don't include male and female, but all the genders, the prevalence of mental health disorders is quite equal. But there are certain specific mental health issues which are rather more prevalent in case of men. Now, if you look at the data around it, then suicides are more in males compared to females. It has been shown across various research data that men are more likely to die by suicide by 2 to 3 times as compared to females. Now,
Right.
why this happens is, as we were discussing about it, men tend to suppress their emotions, right? They don't express their emotions openly because of the stigma associated with it. So, whatever sadness, whatever hurt they have felt, whatever trauma that they've experienced, they don't talk about it. On the contrary, what they try then to do is, they try to cover it up with unhealthy coping mechanisms. And this again sows seed for even deeper mental health issues, right? So, I have a lot of male patients who come to me after years and years of traumatic experiences that they have faced since their childhood years. And now, because all their coping resources are exhausted, they finally decided to seek help. So they generally tend to use, unhealthy coping mechanisms like resorting to substance or resorting to violence. All these cases do come up quite regularly, and I think stigma is one of the major barriers which prevents men from seeking help.
Absolutely. I completely agree with you on that. Shall we move on to the next question?
Yeah.
Do you think men get more? Do you think basically men have more mental health issues than female? Do you think basically men get affected by mental health issues more than women? Is that
The cases of depression or anxiety in men and women are equally distributed, but it has been shown across the research that women seek help more easily as compared to men. So, for example, if a woman was suffering from mental health issues starting today, she is more likely to seek help in the next 12 months, whereas a male would not. So that compounds the issues further. And if you look in the long term, then yes, men then tend to suffer with more mental health issues. And also the distribution and the presentation could be slightly different, right? So for example, if we talk about depression, which is a very common mental health disorder, women may present to you with symptoms suggestive of sadness of mood, disturbances in emotions, not feeling good about their work, decreased interest in other areas of their life. Whereas males would generally try to hide their feelings about emotions. they would
Right.
come up with other issues. They would just come and tell us that, okay, my sleep is disturbed, or I'm not feeling interested in my work. But they would not touch upon the deeper emotional aspects, right? And sometimes because of this, the diagnosis also then becomes difficult, right? We have to take them into confidence, and then once they give a proper history, then we arrive at the diagnosis, and then the treatment starts. So in that sense, yes, on a long-term basis, males then tend to suffer more from mental health issues as compared to females because of lack of awareness about it and lack of openness to seek help.
And I think it is very important to create awareness about it because if the people are not aware, they'll never be able to identify the fact that they need a doctor or they need help. So my next question was about that only. What if a man is having mental health issues and he still refuses to the fact that he wants to go to a doctor? What will happen basically?
Right. So refusal to seek help is again down to some of the wrong beliefs that we have indoctrinated from our childhood. Like I meet a lot of men who come and tell me that men are not supposed to cry, men are supposed to be strong, men are not supposed to be seeking mental health related help because then they would be portrayed as weak. So a lot of times I give them examples of so many men who have been strong, but yet they have suffered from mental health issues, right? And when we come to mental health, there's nothing like strong or weak, right? We are all equally vulnerable from suffering mental health issues. And I, give them example of a famous example of Arjuna in Mahabharata, right? So in the battle of Mahabharata, Arjuna himself suffered from panic attacks. He suffered from anxiety-related issues, which is why he decided to approach Lord Krishna, right? So in Bhagavad Gita itself, it has been mentioned very clearly what are the kinds of symptoms that Arjuna was
Yeah.
suffering from. So there is this famous paragraph wherein it is said that Vipatushya Sharire me Roma Harshya Jayate Gandivam Samsate Hasta Tvakcheva Paridayate Nacha Shaknam Evastatum Gramati Vachame Mana, which literally translates to how Arjuna was feeling in that moment when his entire body was shaking, he was having palpitations, he was sweating, the bow that he was carrying, Gandiva, which was slipping from his hands, and his mind was quivering all around. So all these symptoms, even the strongest of the warriors like Arjuna could face. So who are we? We are mere mortals, right? And I think more and more people have now started opening up, especially because now people have started talking about these issues, right? So for example, if a certain guy like Virat Kohli talks about mental health issues, then many more men are then inclined towards seeking help, right? So
Yeah,
a guy like Virat Kohli, who is sort of an impression we have about him like a macro-masculine guy, he could suffer with mental health related issues as he recently told about. Then all of us can, right? And it is okay to seek help because when you seek out help, you prevent further complications.
absolutely. And it is very important for a person to seek help. What do you think about acceptance? Once he's willing to seek help, or what if the person does not even accept the fact that he is suffering from something? Does
Right. I
that
think
really happen?
that also happens. Again, if they are then willing to accept that they are having some mental health issues, then a lot of them also have this misbelief that okay, I will try to overcome. So yes, we do see a lot of cases wherein even if men have accepted that they have some mental health issues, they do not seek out help because of the wrong belief again that they have this belief that okay, I'll overcome it on my own. So a lot of men they come up to me and when they ask them why were they not approaching us because you were the same symptoms since 1 or 2 years back, then they tell us that okay, I was trying to overcome it on my own, right? So we have to explain about mental health issues in the same way as we explain any other illnesses in a biological way. Just like if you suffer from diabetes or hypertension, you would not be able to overcome it on your own. If you suffer from fever, you would not be able to overcome it on your own. You would definitely seek out medical help. In a similar way, it is okay if you are suffering from mental health issues to seek out help because you have not gone into depression voluntarily. So how can you then push yourself out of it, right? You are going to need some support. You are going to need professional help. And sometimes when the cases are in a milder form, suppose it's a little adjustment issues that they're suffering from, and they talk about it, then they just need a couple of sessions and they feel better, which is why to seek timely help and timely intervention is of utmost importance. Otherwise, the disorder becomes then very chronic and it becomes difficult to manage.
Right. And I think uh, the moment the disorder becomes extremely chronic, then the battle is already lost there. If it would have been slightly in an earlier zone period of time, it could have still be a better impact on his or her life.
Right, that's true.
As we're talking about the impact on mental health issues, when a person is suffering from a mental health issue, what is the rate of curability and the recovery rate? How is it a long process and what is it?
Right. So when we talk about any disorder, in terms of physical health disorder or mental health disorders, there are different terms that we use. So cure is generally a term that we use for anything that has occurred to us externally. Like for example, if you are infected with a COVID virus, if you are infected with a dengue, then we use the terminologies like cure, because when we can completely eliminate the basis of that disorder, then we use the term like cure. But in terms of non-communicable illnesses, now non-communicable illnesses are something that cannot be transmitted from person to person because they're not infective in origin. Like for example, heart diseases, diabetes, or metabolic disorders, or migraine, or you talk about depression or anxiety or schizophrenia. Now these are something, the pathology lies inside us. The etiology lies inside our brain or in other organs, as in case of heart diseases, it lies with the heart. So you do not use the words cure. We use the term treatment and management. Now it is important to understand, like a lot of people have this confusion that okay, you will never be completely cured of it. So cure is not a terminology that we associate with non-communicable diseases, because as long as you are having a functional body, it is going to malfunction any time of the day, right? Suppose, for example, if you were diagnosed with diabetes and you started taking treatment, now your sugar levels are under control. But if you stop taking care of yourself, if you do not follow the exercise, the diet, and the medications that you have put on, it is likely that your sugar levels are going to spike up again. Similar things can happen with depression, anxiety, schizophrenia, or other mental health related issues as well. Which is why you need to be very vigilant and monitor your symptoms accordingly. And if you feel that okay, the symptoms are starting to appear again, then it's okay to seek help again. And at the same time, I would like to stress upon the fact that do not discontinue therapy or do not discontinue medications unless you are told by a professional. A lot of times, what happens is, once they start to feel symptomatically better, then they don't continue the course of the treatment. They stop the treatment abruptly because now, after a couple of sessions, they started feeling better, and then they again go down to the same path. So the process of therapy, the process of medications sometimes is longer because it's a non-communicable illness and the pathology lies inside our brain, which is why it's important to seek help of a professional and only discontinue medications or discontinue therapy when the professional asks you to.
And as we're talking about mental health issues and everything, you as a doctor, as a mental health practitioner, what do you do to improve your mental health? What are the tips and tricks you would like to share about it?
Right. So the basic tips, I try to divide my day according to three important tasks, right? Tasks which give me a feeling of achievement, tasks which give me a feeling of pleasure, and tasks which give me a feeling of connection. I think these three areas of our life, if we try and manage it and balance it, then most of the mental health related issues and physical health related issues will also stay away from us. So the tasks which give you achievement could be, if you're a student, you're studying, so do give adequate time to it and do study with all the sincerity that you can so that it gives you a feeling of achievement. Then the tasks which give you pleasure. Have some hobbies going for yourself. Go out, have fun with your friends, go out in nature, take nature walks, take a break. So these are the activities which will give you pleasure. And then there are activities which will give you a sense of connection, which means talk with your friends, be around your family members, have a social media networking or a group networking, but do go out and meet people. So connection is something which is very important. A lot of times we are seeing now that people are feeling lonely and isolated, and that
Yeah,
itself can lead to mental health issues, right? So if we try and balance out these three areas of our life, the areas which give us connection, a feeling of achievement, and feeling of pleasure, then most of the mental health related issues can be kept up.
absolutely. And I think these small little changes and these small little habits that we adapt will help longer in the longer race to achieve a better mental health.
Right.
And so thank you so much for being a part. You gave such an important tips and tricks that would help everybody out to improve their mental health, and especially to men to come up and talk about it. Thank you so much for such an insightful session.
Thank you so much.
And any signing off messages or anything you'd like to say at the end?
If anybody who is listening to this, you start to feel that suppose your friend is having mental health issues or you are yourself having mental health issues, then first and most important thing is to listen to that person with a non-judgmental ear. A lot of times we have this habit that we start to give blanket advices to somebody. So refrain from giving advices. Rather than that, just try and listen empathetically to that person and tell that person that you are there to help him or her. And that is the most important message that I think we should take forward. And if you yourself are feeling the symptoms of it, then don't hesitate to seek out help of a mental health professional. And nowadays, post COVID, it is great that now you can even approach professionals online as well. A lot of people have the hesitation because of accessibility issues, timing related issues, but now the help is also available online. So do seek out.
And thank you so much. And it was wonderful. And thank you for or each one of you who's watching us. You've been a wonderful audience, and thank you so much. And I'll see you all very soon. So goodbye, and we're signing off.